the evidence that financing these things will be less expensive than in-hospital care. It's evading the issue again.
I think it would be helpful, because Meryl's asked a really specific question. I think it would be really helpful as a follow-up to this meeting to give the pack that demonstrates the evidence behind out-of-hospital care and the cost of provision of out-of-hospital care.
How soon could that be done?
That's the specific question you've asked for. I don't see why we couldn't take that as an action following
This year,
meeting.
2 years' time,
Well,
when?
I would have thought we could do that in the next couple of weeks. So that's the specific thing you've asked for. So why don't we take
Is that specific commitment?
Absolutely.
Can I just add to Tim's point? I mean, Tim's right, there are other things in the STP plan which weren't in Shaping a Healthier Future. So he's absolutely right on that front. But those things are very variable additions, important additions, and correct that we should have a much more muscular approach to mental health, for example. No one doubts that when you look at the numbers that we shouldn't tackle diabetes, we shouldn't tackle the use of sugar, everything that you can to prevent people getting into these scenarios. I think anyone who looks at the scenario, anyone who looks at the evidence will see that it's quite right to want to do more preventative work. Where there is a doubt is on the central points of Shaping a Healthy Future, which are exactly the same central points in the STP, and that is to reduce the number of hospitals, to reduce the number of A&Es significantly, and to do it in a way that completely ignores increases in demand and indeed increases in population. And then, looking behind all of that, what it also does is it doesn't come forward with a solid business plan but allows the public to properly engage in the issue. And you failed to do that time after time after time, the most recent case being 2 weeks ago. And all I would say is I've been a politician for 18 years and I've seen consultations that work and I've seen consultations that don't work. I remember when SaHF was produced as an initial document, they went to consult on it, and it was your predecessor, and we said, well, what if we wanted to complain about this in the consultation, what would it look like? And very dismissively, he said, you'll need to put something as detailed with as much knowledge as we've put together, otherwise it's not really going to be comparable. And that's no way to do a proper consultation. If you want to take a measure of how the public feel about some of the key tenets of Shaping a Healthy Future and the STP, which is closing their local hospitals, then I would just say 22,163 people put me into this position in 2014. They voted my party to take control of the council on a campaign that was heavily around the hospital. If you're going to get anything close to a referendum on saving the hospital, that was it. It's the first time my party has won a popular vote in this borough since 1992. Okay, so I don't want to get into that. I'm just saying, to get that number of people coming out, marking a box on that basis, that's an indication that you do not have public support for closing Charing Cross Hospital, and indeed closing Ealing Hospital, and indeed the central tenets of the STP, which are exactly the same as the central tenets of Shaping a Healthier Future.
So I'm seeing a lot